Thank you, Mr. Chair, Dr. Mohammed, for the chance. Dr. Swana Chai, PPD Board and Director General for Ministry of Health of Thailand. Ms. Dana Keita, UNFPA Executive Deputy Director. And Excellency Deputy President from Zimbabwe. Dear Ministers, representatives of UN organizations, participants, ladies and gentlemen, thank you very much for coming, and well, good morning to all of you. I want to reiterate what the previous speakers have said, especially on the gains that we have already made, the challenges that we are currently facing, and I want to still again reiterate on the importance of South-to-South and triangular cooperation on this specific matter. I would like to thank PPD and UNFPA for arranging such an important event where we can share experiences and where we learn from each other. I would also like to thank the government of China and other countries who are supporting this important PPD platform where countries could benefit more. The 1994 ICPD summit in Cairo was groundbreaking, as many of you have already said, in transforming how the link between population, poverty reduction, and sustainable development were linked and how they were addressed. The mechanism was by putting people first, especially by putting women and girls at center of development, and that was the right strategy, and the government of Ethiopia, and specifically Minister of Health, dwells in this important decision. So over the last 2 decades after ICPD Cairo summit, we have implemented a program of action, and since then we have enjoyed improvements in many indicators that we had in terms of decreasing maternal and child health mortality, improving CPR by more than 6-fold over the last 2 decades, and also total fertility rate have dropped significantly in Ethiopia. The unmet need also dropped significantly, and of course, safe abortion services are now available in all corners of the country. Especially with adolescent youth health, the government of Ethiopia has recently given a due focus and attention to this important service, and every year we are making a huge youth forum, specifically to address the real engagement, meaningful engagement of youth in economic empowerment and also in health issues. Though a lot have been done and a lot have been achieved, still we have many unfinished agenda on our table. One of the serious challenges that we had in Ethiopia is the huge disparity among those indicator achievements in urban and rural, and also disparity in agrarian and the pastoralist area, and also big equity gap between the rich and the poor segment of the population. Of course, another important area where we are discussing on this platform is the community security challenge that we are facing every day, and also unbalanced method mix for family planning acceptance is also another serious issue where we have to work together on. In line with this one, Ethiopia used the Nairobi ICPD 25, and we have endorsed the 3 zeros: preventing zero maternal deaths, zero unmet need, and also zero harmful traditional practice. And we have incorporated these 3 zeros in our RH strategy, in our 5-year plan, and also in our annual plan and many strategies that we are designing at ministry and also at regional level. We are also in the process of establishing a task force that oversees the achievement of these 3 zeros every time. Ladies and gentlemen, the government of Ethiopia, and specifically Minister of Health, is giving a serious attention on this matter, specifically on capacity building. And at this time, we are setting up a huge center of excellence in one of our big hospitals, which is linked to 9 other universities. And in these areas, we are seeing improved quality RH services in those areas, and also in terms of education in those areas, we are working on RH trainings. So RH was incorporated in our curriculum in universities and in our colleges. And recently, we have also started fellowship program on family planning in different universities. So concerning the program service areas, especially we are working seriously this time on long-acting family planning methods, and more than 35% of family planning acceptors are now they are put on long-acting family planning services. And from this, especially over the last 2 years, we seriously are working on immediate postpartum intrauterine IUD. So more than 10% of our women are receiving postpartum immediate intrauterine devices, and that is one of the lessons that we have that we learned from on, especially over the last 2-3 years. And also Ethiopia has a very known flagship program which is working at community health level. So it's called, I think most of you know it, it's health extension program. So we have health posts staffed by 2 health extension workers. They are permanent government staff that works in the lowest level of the administrative unit, which is called Kabale, local by our local language. So they are trained to insert implant at that lower level. So almost half of the implants that have been provided to our women was done by health extension workers. So we gave them serious training on this matter, and we're also continually working on that issue. So we achieved all this given the multiple challenges that on the ground: COVID, everything I've said, emergencies, conflicts, droughts, climate change, and so on. So, ladies and gentlemen, going forward, as we are approaching the ICPD 30 soon, we need to harness the benefit of South to South and triangular cooperation to achieve ICPD plan of action. And so I want to also reiterate the importance of this cooperation, and under this platform we can support each other, we can learn from each other, and we can also share our experiences. So we can use this partnership to share what we have and to learn from each other. One important area that requires an attention from all government, and that the government of Ethiopia is also working, is to avail more finances to allocate more resources from ministries towards family planning and SRH activities, and of course for this cooperation platform. So the government of Ethiopia has one experience on this matter. So we have already signed the compact documents that was designed with UNFPA, and we are also contributing toward this procurement of family planning commodities. This year alone, we have contributed more than 2 million USD from government treasury, and we are also contributing from SDG pool fund. And this time we are working with CSOs, private companies, and also our partners to mobilize more resource on this matter so that we secure our commodity needs. And we are also establishing this time equity and resilience fund, especially after the lessons that we learned from COVID, and it's on the process of establishing. So I'm sure some funds will go to family planning procurement. And especially the government is now working on sharing some funds that are taxes levied on tobacco to be channeled to health sector, specifically on some serious matters, including family planning commodities. And these are what are being now exercised in Ethiopia. And this time especially we are working on community-based health insurance, and we are also working on social health insurances that will cover the formal sector. And discussion is undergoing this time to include family planning as one of the benefit package of community-based health insurance. So it's progressing very well, and in different ways we are planning, and we are looking forward to secure our commodities for family planning and also for other SRH and maternal health commodities. So, I mean, measuring progress, I think some have already said on that one. Is very important, measuring progress in terms of family planning and other key indicators. So we are doing DHS demographic and health survey every 5 years, and every 2 years we have PMA performance monitoring for action. So I mean, data is very important, and we have to also dwell in having quality data to measure our performance and to see what have worked and what didn't work. Finally, I want to reaffirm the commitment of my government of Ethiopia, and in particular Ministry of Health, to work on this platform to work with South to South and triangular cooperation for achieving ICPD plan of action. And I want to call upon our partners to support this South-South triangular cooperation and to support ministries in family planning and SRH and beyond. I thank you.